Today we're going to talk about something that people struggle with a lot, and that's foot pain that won't go away. In particular, a lot of people think they have what's called plantar fasciitis, and today what we're going to do is go over the different diagnoses that may actually be causing foot pain, because when you incorrectly diagnose or assume what's going on, you devise treatment plans that seem to work just a little bit or temporarily, if not at all. And one of the most important things to ever treating any injury is to understand what injury you're treating in the first place. So we're going to start with plantar fasciitis, and then we're going to go into things that might look like plantar fasciitis. My name's Dr. Tom Padilla. I own the Doctors of Physical Therapy in Scottsdale, and we specialize in helping active adults overcome injuries that are undiagnosed by the rest of the medical profession and help them regain active lifestyles without needing to rely on painkillers or surgery. So the first thing that we need to do when we're talking about plantar fasciitis is start to understand what the plantar fascia is. And if we look where I've highlighted in green on this application here, let me make sure that we can just see it. Okay, that's the bottom of your foot. Okay, and on the bottom of your foot, there's this thing called the fascia. And the fascia runs basically from your heel to your toes. Now, what a lot of people don't know about the plantar fascia is this app is a little bit anatomically incorrect, but it actually has fibers that continue from your calf muscle here in your leg. So your calf muscle, if I zoom out here, okay, you'll see that your Achilles that is here actually attaches to the plantar fascia. So it actually will form one tissue as it goes around that heel bone and then pulls into the structure that is the plantar fascia there. So what is plantar fasciitis? Plantar fascia is this thing, and then the itis just means that there's acute inflammation in that area. So what happens is you get little tears in this plantar fascia, and then what starts to happen is at night, these tears start to heal. And then when you get up and you go to take those first steps in the morning, that's the classic sign of plantar fasciitis, when those first steps hurt, causing you to limp, but then it goes away over time and things get better, okay? So what happens is the fibers here will get torn over time, and it's called a degenerative condition because when you have plantar fasciitis, it's not something that happens at once like that. It's actually more like a butter knife on a rope, and it just sits there and it frays over time. Now, this can have a lot of different causes. Not only do we want to know the diagnosis as what tissue source is the pain coming from, but also what's the reason that it's there in the first place. And in the case of plantar fasciitis, you can have different causes such as your calf is extremely tight, so you overpronate. Okay, and that pronation causes your foot to flatten, and that causes the fascia to stretch and tear. Or maybe you've got a heel spur. And a lot of the times, it's not just the heel spur that's causing you to have pain, it's the fact that you've got a heel spur that's coming off of the calcaneus bone right here. So if I go and I hide everything else, you can see how this calcaneus bone right here, which is your heel bone, if it develops a bone spur right underneath it, well, that's going to start to tear that plantar fascia a little bit right there over time. And then if you're pronating, all you're doing is pushing force into that plantar fascia. So a lot of people think they have plantar fasciitis, as I mentioned earlier, and the classic signs of that are the painful steps first thing in the morning when you get up to get out of bed and you start walking and you're limping around, but then it gets better quickly. Now, in my office, I see a lot of other people who just think that they have plantar fascia, and we do a lot of diagnosing to figure out what other tissues might be involved. And there's a couple key ones that we want to consider. Now, the first one is actually local to the area as well. So it's the calcaneal nerve right here. Okay, so I'm going to go ahead and unselect things, and then I'm going to zoom in on this nerve right here. Now, this is your calcaneal nerve, and I'm going to fade everything else, okay? And we can see how that nerve gets trapped in the ankle and it runs down underneath the heel right here. Now, if that nerve is trapped in any sort of tissues in this area, maybe you've had a history of an Achilles strain, or you've had different ankle sprains in your history, it can cause this nerve to just become a little bit stuck or entrapped in these areas, and it can actually send pain into the heel. This is important because one of the things that you'll notice with this condition is that it doesn't happen just those first steps in the morning. In fact, it's kind of no better, no worse in the morning, but it can happen after long walks and at the end of a long day or being on your feet for a long time. And that's more classic of the calcaneal nerve being entrapped. Now, the other one that can happen in this area is posterior tib tendinitis. Okay, so you've got your flexor digitorum that I just highlighted there, and your posterior tib. And if I go ahead and fade everything else here, you're going to be able to see how this muscle actually starts up in your calf and it wraps around the ankle bone here and then hooks underneath that arch. Now, if you've got a long history of either having your feet collapsing over time, or foot and ankle weakness, or hip weakness, or even just calf tightness, what can happen is because your arches are collapsing all the time, this tendon is having to work overtime. Okay, and because it's constantly getting pulled on and flattened, you're going to start having pain right behind this malleolus. All right, you're going to start having that pain kind of wrap around the backside of that ankle here. Okay, now there is a fourth thing that we always want to be conscious of. So we have the plantar fascia that we just discussed, which is that tear down here. We have the calcaneal nerve that can refer pain down into the heel. And then you have what's called posterior tib tendonitis, which is going to be a little bit higher and behind that what's called the medial malleolus, or that ankle bone on the inside that sticks out. Okay, that's going to be the most sensitive area in posterior tib tendonitis. And then we see a lot of people who actually come in reporting, yeah, I have plantar fasciitis, but it's actually on both sides. And for that one, when it's on both sides and it gets worse together and it gets better together, anytime you have something happening on both sides, you need to look up the chain, because what can also give you pain in your heel is your S1 nerve root. And that comes back to things that are happening at your hips and at your spine. So we're going to zoom out and come all the way up here. Okay, I'm going to get rid of the muscles, all right? And then I'm going to help you see where your S1 nerve root is. Okay, so what we did, we came in from behind, we zoomed all the way in, and now we're looking at what is called your sacrum, or your tailbone, okay, right here. So we're going to go ahead and highlight both that as well as the little nerve root that lives inside of that, and then we'll go ahead and hide everything else. Okay, so that is your S1 nerve root right there. Comes right out of that little hole, okay? Here, now, if that's what's causing your pain, and there's issues happening here in the L5-S1 spinal canal here, that's what's going to cause pain to happen on either side. And it's important to know that if there's something going on here, that can also cause your foot pain. The majority of the time, the people that come to us, and they're saying they have plantar fasciitis on both sides, they also are reporting a history of back pain that is unresolved. And it might be that lower level back stiffness that kind of comes and goes, that everybody accepts as normal. But the truth is that that's not quite normal, and these types of things, if left untreated over a period of time, can start as a little bit of nerve root irritation here, but can mask themselves as plantar fasciitis, and leaving people chasing symptoms, feeling like they're never really progressing. And again, it's those issues at the end of the day where they feel like they've been on their feet for longer, and the longer that you're on your feet, the worse this type of condition gets. Now, we've just covered one of the most important parts of diagnosis, which is what is the tissue source. But we wouldn't be accurately diagnosing, at least in my opinion, if we didn't also back up and ask ourselves why. And so that's what we're going to talk about next, because when we run around just treating the tissue, okay, and what is hurting, that's what leads to short-term solutions. So you run around getting injections, or you stretch, or you get massage, and things feel good for a little bit, but those types of things and that relief starts to last shorter and shorter and shorter. And that's the classic sign that you're just treating symptoms and you're not actually treating the cause. So here at our clinic, we focus on the what diagnosis, which is what tissue is causing your pain, and why. So the movement impairments and the mechanics that are causing that to happen in the first place. And to help you better understand this, we're going to break down physics really simply, okay? So we're going to go ahead and get rid of the nerves here, and we're just going to zoom out on the leg. So in each of your legs, you've got a hip, a knee, and a foot and ankle, okay? And I think we can all agree that in order to walk, your body has to absorb force. So let's go ahead and say that your hip, your knee, and your ankle all absorb force at about 33%. So that makes up 100% of your body weight. When you're walking and you pick up your right leg in the air, all your weight's on your left leg. Let's say that each joint has to absorb it 33%. Now, what we find in our clinic a lot is that when one joint isn't doing its job, the other joints suffer. So for the argument's sake today, let's just say that your hip is weaker than it should be, or when you stand on one leg, you actually kind of feel imbalanced. Well, that means that your hip is not going to be absorbing that 33% of your body weight that it should, and it's going to leave the knee and or the ankle, the foot and ankle, to absorb more force, okay? What that's going to cause to happen over time is it's going to cause your calf to start to tighten up, okay? And as we covered earlier, if your calf starts tightening up, that pulls down into your plantar fascia. That can also cause you to overpronate. So it can start to cause both that plantar fasciitis and the post-tib tendonitis that we had earlier. And it can also cause pulling at that medial calcaneal nerve. Now, if your hip is causing that to happen to your calf, it's also causing things to happen up at the hip. So it can start to cause strain to this area here, to your SI joint, because if it's not absorbing force, it's going to pass forces up, and it can cause different things to happen in not only your SI joint, but in your low back. So in this case, if we're dealing with foot pain, it could be that we need to address the hip because it's either plantar fasciitis or post-hip tendonitis or the calcaneal nerve, or we need to address your hip because it's affecting the S1 nerve root up here. Now, the hip is just the example that we chose in this situation, but the same can be done for each joint in your body. And what needs to happen to get an accurate diagnosis and not have foot pain that keeps coming back and only going away for short periods of time is to step back and not only diagnose the tissue source, but the why it's happening in the first place, whether it's the hip, things happening at the knee, or the foot and ankle. So I hope that helps you understand the different types of things that can be going on with your foot and ankle and why you might have struggled with classic plantar fasciitis treatments if you have already tried those. If you need help figuring out what's going on with your foot and ankle, be sure to reach out to our clinic in Scottsdale, Arizona, where we can help you get back to an active lifestyle with confidence without needing painkillers or surgery. We can't wait to help you live life today.